Our Verify team is working hard to bring you the facts about COVID-19 vaccines.
There are, of course, many questions about side effects, including whether the vaccines can impact the results of a mammogram. Here's Terry Gruca.
There's a lot of information out there about vaccines and things you should consider before getting the shot. You may have seen questions about cancer screenings. A lot of my friends are asking, can the COVID-19 vaccine affect the results of a mammogram? Let's verify. Physicians at MD Anderson are seeing an uptick of mammograms and other diagnostic imaging exams, showing findings that can be confused with cancer in patients who have recently received one of the mRNA COVID-19 vaccines. That's the Pfizer or Moderna ones.
My name is Julie Sprunt. I'm a breast surgical oncologist.
In clinical trials for Moderna vaccine, about 16% of patients between 18 and 64 and about 8.4% of patients over 65 developed swollen lymph nodes within 2 to 4 days after their vaccine.
In the arm where they get a COVID vaccine, we're seeing the lymph nodes in the axilla or armpit become enlarged after the vaccine. Not in every patient that gets the vaccine, but it's a pretty common reaction.
Lymph nodes are one of your first lines of defense. They typically swell as they react to bacterial or viral infections. And so it is common for vaccines to trigger the same response in your lymph nodes.
We're noticing that, in women who have normal breast imaging, some of the lymph nodes that we can appreciate on mammogram do tend to look a little bit more enlarged following some vaccines. The important thing to know is, in all likelihood, it is a vaccine reaction. And when you go in for breast imaging, it's important to tell the breast imaging team that you've had a recent COVID vaccine and also specifically which arm you had it in.
Doctors say most people see that reaction on the same side of the body where the vaccine was administered.
Most of the radiologists are recommending either a follow-up ultrasound in 1 to 2 months to make sure those lymph nodes look okay.
So we can verify the COVID-19 vaccine can cause a temporary enlargement of lymph nodes. Enlarged lymph nodes can cause a false positive on your mammogram. If you want to get the vaccine, schedule your mammogram before your first dose or wait 4 to 6 weeks after your second dose. With your Verify, I'm Terry Gruca.